Sanford Health is one of 9 healthcare systems partnering with the National Cancer Institute for Connect for Cancer Prevention Study. Joining us this morning with more details on the partnership and study is Dr. Chung-Hung Chan. Thanks for being here.
Thank you for inviting me.
All right, so kind of just tell us about this partnership and why it's maybe unique.
So we partnered with the National Cancer Institute. They actually invited us to participate in this very important study. And the study really is looking at what causes cancer and how we can prevent it. I think recently, and actually I think it was in the news yesterday, that up to half of all cancers are preventable through lifestyle changes. So I think it's a very kind of pertinent kind of study to be looking at is, how do we identify other causes of cancer? So with this study, what they are looking for is, are there things to do with your genetics, your lifestyle, where you live, what you're exposed to that could actually, result in you developing cancer of some form, and are there ways to actually prevent it? So in order to do that, we actually need to, have a lot of people to study. And uniquely for a cancer study, we're actually looking for people who don't have cancer, because this really is a kind of before and after study. We're hoping to enroll people who don't have a history of cancer, follow them over a course of 10 to 20 years, and some of them will probably develop cancer at some point. And we can then look at the people who never develop cancer versus the people who do develop cancer, and kind of compare them and see, are there differences between those two groups? And are there things that we could change? Is it because of exposure of some kind? So I think the unique thing about it is that the National Cancer Institute has really tried to look for partners in large, very diverse areas of the United States. I think one of the things that attracted them to us was the large rural population that we have, and obviously we have very unique exposures. We have a lot of farmland, so maybe we get exposed to more farm chemicals than other people who might live in large cities, like Detroit, where there's another site that's enrolling. So that's really the kind of uniqueness, is like they're really looking to look at people around the entire country as opposed to just one particular area.
Yeah, very interesting. So if people are kind of interested in more on this study or getting involved even, how do they do so with that? To get involved, you have to be between the ages of 30 and 70 years old to participate. You have to have not had a history of cancer, and you do have to be a Sanford patient to participate. To get involved, some people, we're actually actively sending invitations to some people, and we're kind of sending out invitations every week. So for some people, they might receive an invitation through, say, their MyChart online portal. But for others who want to get involved, they can actually visit a website where they can enroll, and the website is myconnect.cancer.gov. Okay, well, thank you for being here this morning. Appreciate it.
Thank you.
We'll be right back after the break.